This is Dr. Epstein. I'm here with an interesting case. Patient had prior plugs many years ago, hair plugs, and there's several ways to deal with this. One way is some doctors will attempt to do laser or electrolysis. The problem is you don't treat any of the scarring that was a result of the prior plugs. Another way to address this is to actually individually remove each plug one at a time, and I've done a number of those cases. Advantage of that, it's less involved procedure. The downside though is that you don't remove any of the surrounding scar tissue that was a consequence of the plugs. And the third approach is the one I'm going to be doing on this gentleman who, as I said, had plugs more than 20 years ago, where I'm actually going to do a hairline excision, an entire hairline excision, which will heal as a fine line scar. Let me go ahead and show you what we have here. You can see that these are the prior plugs. It was scattered throughout his scalp, and his hairline is just 6 centimeters, 5.5 to 6 centimeters above his nose, and 5.5 centimeters above his eyebrows, which is far too low. Plus, you can see it's still on the vertical. It's on the vertical portion of his forehead. So the plan is to bring. You can see I've marked out the area to be excised, which is going to have all the plugs. So this forehead skin is going to come up. This scalp skin is going to come forward, so his new hairline, instead of being down here, will be more around here, maybe even a touch higher if I can achieve that. The result will be I can remove all the prior grafts, leave them with a fine line scar that in as soon as 3 to 4 months, we can then come back and do some transplanting to conceal if that scar is at all shown, which typically it'll be a fine line scar, which is much less obvious than that scarred plug tissue. That was Dr. Epstein showing a hairline excision preoperatively. Thank you.